Grief changes the way our mind and body are functioning. It's a complex neurobiological process, and traumatic grief is even deeper and more complex, especially depending on the type of trauma that we've survived. If we've experienced attachment trauma in our past, developmental or complex trauma, our brain is even more vulnerable to encoding and remembering moments where we've been left, where we felt betrayed or rejected, where we have great anxiety around people not being present, which grief encompasses. Loss is a big part of our mind and our body trying to make sense of what used to be and no longer is. Trauma makes our brain more vulnerable, more reactive, and more receptive to encoding and remembering future stressors. Similarly, so does grief. Both are physiologically taxing. And when we layer grief on top of a vulnerable, traumatized brain, it's as though all of the symptoms of trauma can be anteed up, and we're more vulnerable across the board, both neurologically and biologically.